A 20-year-old male presents with sensory loss in his limbs and trunk who is a recreational nitrous oxide user. I am showing you sagittal and axial cervical spine T2 weighted MRI scans. Describe findings.
Let me just study this for a second. Right? The sagittal T2 weighted spinal MRI demonstrates a long segment of hyperintense signal abnormality within the posterior aspects of the lower cervical and upper thoracic spinal cord. This hyperintensity spans multiple vertebral segments without causing any focal cord expansion or swelling. On the axial T2 weighted image, this signal abnormality is symmetrically localized to the dorsal columns, displaying a characteristic inverted V-shaped configuration. The surrounding spinal canal is capacious, and there is no evidence of extrinsic cord compression or vertebral disease. The findings are diagnostic of subacute combined degeneration of the spinal cord.
What are the differential diagnoses for isolated bilateral T2 hyperintensity of the dorsal columns?
The differentials for isolated dorsal column T2 hyperintensity include metabolic deficiencies, toxic myelopathies, infectious causes, and demyelinating diseases. Copper deficiency and vitamin E deficiency can produce an identical radiological appearance and must be clinically excluded. Infectious myelopathies like HIV, vacuolar myelopathy, or tabes dorsalis in neurosyphilis also target the posterior columns. Demyelinating lesions such as multiple sclerosis, transverse myelitis, or neuromyelitis optica can affect the dorsal cord, but they are typically asymmetric, eccentric, and span shorter segments on sagittal views.
Explain the relationship between nitrous oxide use, vitamin B12 metabolism, and the pathophysiology of subacute combined degeneration.
Nitrous oxide, commonly known as laughing gas, irreversibly oxidizes the cobalt atom of vitamin B12 from its active monovalent form to an inactive form. This inactivation inhibits methionine synthase, an enzyme vital for myelin sheath synthesis and maintenance. The resultant functional vitamin B12 deficiency leads to progressive demyelination of the heavily myelinated fibers in the dorsal columns and lateral corticospinal tracts. This demyelination preferentially affects the cervical and upper thoracic regions, presenting clinically with sensory ataxia, loss of vibration and proprioception, and spastic paraparesis. Recreational nitrous oxide abuse has emerged as a major cause of subacute combined degeneration in young adults.
Why are axial sequences critical when evaluating sagittal spinal cord hyperintensity, and what are the key practical tips?
Axial spinal sequences are critical because sagittal T2 hyperintensity is nonspecific and can mimic transverse myelitis, cord infarct, or tumor. Localizing the signal to the posterior columns on axial views is the key step to narrowing the diagnosis to subacute combined degeneration. The pathognomonic inverted V sign or rabbit ears appearance of the dorsal columns is only visible on axial slices. Always correlate findings with a thorough clinical history, paying close attention to dietary habits, gastric surgeries, or recreational inhalant use.
Discuss the definitive diagnostic tests, therapeutic options, and how you would manage this patient as a radiologist.
Diagnostic workup should include measuring serum vitamin B12, methylmalonic acid, homocysteine, and active B12 levels. Treatment consists of immediate cessation of nitrous oxide and prompt initiation of intramuscular hydroxycobalamin injections. Early treatment leads to complete resolution of both imaging findings and clinical symptoms, whereas delayed therapy can cause permanent neurological deficits. As a radiologist, I would immediately call the clinician to alert them of this finding and recommend urgent vitamin B12 replacement therapy.